Hey, it's Dr. Vinay. Congratulations on completing your ACS session. In this video, I want to make sure that you're doing aftercare properly. And we're just going to go over a couple steps, but it's relatively easy. This is meant to be a lifestyle procedure. You can come in for lunch, you can go back to work, and you shouldn't have to worry about anything. But there are some things you need to do to make sure you don't have swelling, which is our most common problem with ACS. The more kits you have, or the closer you are to the hairline, the fluid which was taken in is going to migrate down with gravity. And it is the fluid that's in front of the face that can cause problems. You usually don't notice it too much in your forehead because the skin is thick and tight, but as soon as it moves past the forehead and into your eyes, which are very, very thin skin, and they can poof up. And once it goes down your face, you can feel a little bit of poofiness, and that can take 7 days to resolve, but it can be prevented with massage. So how do you massage? There is a technique. You're going to take your thumbs and you're going to put it on your forehead, then brace your fingers on the side of your head. And we're doing this so we can really generate as much pressure as possible before we push down. So you're not going to hurt anything here. Next, we're going to milk across the forehead, moving the fluid that normally move downwards, and we're going to actually push it off to the sides. And then we're going to push down to the area in front of the ear. And that's because that's where the main lymphatic drainages systems for the face is. If we get the fluid to area, we keep it from coming down to our eyes. Now, like I said before, the forehead is thick skin. It's really hard to notice some swelling, but it definitely could be there. So massage, massage, massage. Afterwards, that's the number one thing. Okay, restrictions. I don't want you to increase blood flow to your scalp for 1 day because I want the cells to release their growth factors and them to interact. And I don't want blood going up there and diluting that process. So what are things that can raise the blood flow in your scalp? Number one, exercise. Avoid it for the day of the procedure. You can go back the following day. Any kind of heat, hot showers. I said you can wash your hair the day of the procedure. That means use lukewarm water or cooler so you're not increasing blood flow to scalp. So just try to think about things that increase the circulation in your scalp. If you feel throbbing, that's an indication that the blood flow is high. Topical medications, just pause for 1 day. Those little pulse, the medications may have something that can irritate your skin. Those holes are going to heal up in a day, so skip it the day out. Hair products, you can use the next day as well. Okay, next big thing is what kind of medications can you take if you have pain or headaches. Pain is very uncommon, but people can experience throbbing in the scalp, sensitivity, little zingers. Remember, we're doing injections about 3 to 7 millimeters apart. So we're going to go all the way across the area of the scalp, nice and diffusely. And there's going to be some things like blood vessels, nerves, and going to be in an area creating these kind of sensations. So in the case that happens, do not use NSAIDs unless you have to. NSAIDs are anti-inflammatory, and wound healing is an inflammatory process in the beginning. And we don't want to hinder that process. I will love it if you can avoid using NSAIDs during your entire ACS process. That's 6 months long for most people. However, if you have back pain, NSAIDs are the best thing for you. Go ahead and take it intermittently. Avoid it for taking it for a long period of time, especially after your procedure. The way to control your pain is Tylenol. Actually very effective with the headaches and the throbbing sensation. Now, if you're someone who normally has headaches, you may want to consider taking Tylenol before your procedure. Okay, that's it. This really should be a lifetime procedure. You should be in and out. That's it. I'm looking forward to see you for your next session, or if you're done, congratulations. We should see our maximum results in about 3 months.